Balancing the competing priorities between our teaching responsibilities, the scholarly work that we do, and our ability to be a really good teacher in the classroom can be somewhat of a challenge, especially when we add the community expectations that we have, whether it's serving on a committee or maybe there's a special project that you're working on, such as mapping the essentials to your curriculum. These are all competing priorities that are really important, but how do we make the time and ultimately find the time to balance it all out, to figure out how to do a really good job in all of these areas? In this snapshot, we're going to explore what is the primary focus of the faculty role. How do we move forward on our journey towards nurse educator excellence or towards C&E in making sure that we dot every I and cross every T? I just attended a conference in New Orleans, and a big focus during that conference, just like many of the conferences, is that we are able to deliver these evidence-based practices that we know are cited in the literature that ultimately provide a better learning experience for our students, and there's better outcomes as well. Welcome back to Dr. Sellars Educate, everybody. We are excited that if you're returning, if this is your first time, we're excited to have you here as well. Make sure you subscribe to our channel so every single time a new snapshot is released, which usually happens every week, you'll be notified right away. The next step I want you to take is to pull out Billings and Halstead. Now, we still use the 6th edition, and there's a reason for that. And it's because the current exam, if you're on the journey to C&E, is mapped to the 6th edition. At the time that the exam was revised, the 7th edition was not available. Okay, so that's why we're still using the 6th edition. We're going to start on page 3. We're starting from the beginning, chapter 1, going back to some of those foundational concepts related to our responsibility to teach in nursing education. And then the second step I want you to take is to go ahead and print out that study worksheet, and that's listed right here in the description if you do not have access to that right now, or if you're not sure where to find it, the best step to take is just to click the link in the description. All right, so we're going to start, as we always do, with our thought-provoking question. But before we go there, I wanted just to provide a little bit of foundation and context as we talk about this really important topic, which is our future. More importantly, what is the future of nursing education, and how do we best support the initiatives that we know are critical so that we can master the art and the science of teaching? That's exactly what we're talking about. What is it that it takes in order for us to be effective in our role? Now, I know some of you have some experiences in this area, so I want you to go ahead and write that down on your study worksheet. Okay, so that's first step. Write down what is it that you feel like helps you, what have you mastered in the classroom, in the clinical setting, in the SIM or skills lab that has really equipped you with the expertise that you need to do a really good job. All right, and then I want us to think about, after you write that down, at least one tip you would share as a mentor to a new or experienced nursing faculty member that has helped you really master the art and the science of teaching. Now, it doesn't mean that we know everything there is about teaching, because we know that just like in the nursing profession, in the nurse teaching profession, we are committed to lifelong learning. There's always new, exciting evidence-based strategies, new, exciting research that we discover and integrate into our everyday work. The second step I want us to think about and kind of reflect on is the nursing care that's required at the bedside. Now, we know that nursing care today, the complexity of it is different than it was 10, 20 years ago, right? It's all been a challenge, various decades, but it was very different 10 and 20 years ago. Let me give you one example. We were not using simulation, not at the degree we are today, 20 years ago. There's so much advanced technology, which is a key point that we're going to talk about today. And so what it allows us to do is really leverage technology in a way that promotes the development and ultimately the advancement of learning. In the clinical setting, we know that so many of our nursing students start to feel overwhelmed pretty easily when they start thinking about all of the technologies and all of the competencies that they have to marry together. So they not only have to do a really good job of making safe patient care decisions, but they also have to do a good job at documenting that care delivery, as well as utilizing the various technologies that are required in the clinical setting. So yes, we've always had some type of technology, even if it was something as simple as the IV pump, at least over the last 30 years. But there are always new advancements in technology that we have to make sure that we as faculty, first of all, are competent in, right? So we get the training we need. And then second of all, we have to ensure that we have developed guidelines and policies as to how our nursing students, our new graduates, will practice in the clinical setting. A great way to do that is by implementing those steps in the simulation and in the skills lab area. So students can get accustomed to going to look at a policy and figuring out what resources they need to ensure that they are following whatever policy is in place regarding the nursing care practices. All right, so now we're going to take a look at our thought-provoking question, because that's the next step I want you to take. So the first step you've already taken on your study worksheet is to write down at least one strategy, one tool, one resource that you would share with a mentee as to how what skill or what technique, what strategy you have mastered to help you become a really good educator. The second step that you're taking is you're reflecting on what is it right now that you don't feel very competent in? Okay, so second step is a vulnerable step. I want you to write down what is it that you feel most unease about. Maybe it's a specific technology, maybe it's an IV pump, maybe it's something as simple as technology in your LMS. Maybe you haven't figured out how to review an exam analysis report right out of your technology, as an example. All right, so I want you to write down what is it that you still have a gap area or competency challenge with. And then we're going to take a look at our thought-provoking question. All right, so here we go. What is the most significant factor influencing the transformation of the faculty role in nursing education over the next decade? All right, so these are our choices. So we have A, rapid advancements in educational technology, B, increasing emphasis on evidence-based teaching practices, or C, widespread faculty shortages. All right, so I want you to take some time to think about the two questions we always ask ourselves. First of all, what is this question really asking me? And second of all, what is it that I know for sure about content related to this question? Oftentimes, there can be a distractor in the STEM. With this specific question, it's not, right? It's just a very straightforward question. And these are thought-provoking questions. What does that mean? Exactly what it says. We want to stimulate thought. We do not write questions for NLN, and so therefore, you don't have to stress out about whether or not this question is written in a way that gives you a clear question about content. Or maybe you're just a little unsure about what the question is asking. All right, so the great thing is we debrief about this question. We go over the correct answer, but we also talk about rationale. As you are using Dr. Caputi's C&E review book, we want you to take that exact same approach. We want you to look at, yes, get excited if you chose the correct answer, or you're taking the SAE, the self-assessment exam by NLN. Those are the only two resources we recommend related to questions other than our thought-provoking questions. But the practice questions we want you to use are the ones that we provide because we go through each of the rationale and we map it back to Billings and Halstead. Okay, that's a really important step. The other resource you can use, like I said, is Dr. Caputi's review book. At the end of every chapter are some practice questions, and then you'll also see the answers in the appendix, okay? And it'll be a little bit of the rationale related to the correct and the incorrect answers. And then the third resource that you have is going to be the NLN self-assessment exam. Now, for some colleagues, it helps, others not so much. It's about 50-50, so this is what we say. If you have a lot of test anxiety, the self-assessment exam is highly recommended. We've seen it be very helpful for those colleagues that really struggle with test anxiety. The second benefit, or the second group of colleagues that the SAE benefits, are those that just want more practice questions, right? We just heard that at the AACN Transform 2024 conference, several colleagues said, and we were delighted to see them. By the way, we're always excited to meet you all in person. So make sure if we're at your conference that you're going to in the future that you stop by our booth just to say hello. And we always have a gift. So make sure you stop by. But we love it because so many colleagues came up and said, your program really helped me be successful. Or they said, I'm on the journey. I need a little bit of motivation. Or they may have stopped by just to say, you know what? I haven't really thought about it. Can you tell me more information? So wherever you are on your journey, remember, this is a no judgment zone. We are here to support you on your journey until you are successful. Okay, so hopefully I've given you a little bit of time to kind of process what you think the correct answer is. Now we want to go to Billings and Halstead. All right, so I'm on page 3 under the category or the section that says Future of the Faculty Role in Higher Education. And I'm going to read content from the textbook. I want you to read along with me. If you're driving or multitasking, which I know some of you all are doing, and that's perfectly fine because I know life gets busy, that's okay. Just write it down or come back to this part of the snapshot when you're at a place where you can take a look at the reading together with me. Okay, so page 3, where we're going to start, is that third sentence in that first paragraph. It says, changes in healthcare brought on by the Patient Protection and Affordability Care Act, which was in 2010. I can't believe it was that long ago. And subsequent political changes to how healthcare is organized and financed require that nursing curricula be updated to ensure that nursing graduates achieve competencies needed for the future. All right, so I want to stop right here. When we talk about competencies needed for the future, we first have to start with ourselves. So taking a look at those NLN, nurse educator competencies, yes, it's about achieving C&E success, and that's the primary reason why we've mapped all of our programs to the competencies and to Billings and Halstead. But the second and really the most important reason is to ensure that we are practicing at the competent level. Okay, so we want to have that higher level knowledge in a way that allows us to apply and analyze the rationale for the teaching strategies that we are using. We know it's not just enough to teach. We have to validate that learning is actually happening as part of that teaching learning experience that we develop and craft for our students. All right, what else does it say on page 3? I want to bring to your attention the next sentence. It says, there is increasing emphasis on the teaching role of faculty without a concomitant reduction in scholarly requirements. Well, what does that fancy concomitant word mean? Well, it just means in congruence, right? Or in alignment. So we're not looking at it from a parallel standpoint. Yes, we know that scholarly work has to be in place. That's how we make sure that we are providing the best content for our students. But the second part is, how do we make it all fit on one plate, right? So something gets shifted off because there's only so much time in a day. All right, so what is it that we want to do? We want to be able to balance that. That's what we're doing as we immerse you all with content in our comprehensive programs. We are introducing a concept called micro-learning when we have our snapshots, right? This is only an intro. We want you to, whenever you are ready to move forward and focus on your C&E study plan, that's when we want you to come over into our programs. We don't want you to spend a lot of time combing through all of these snapshots and kind of piecing it together. We want you to move forward with ease, and the best way to do that is to join a community that's going to support you on your journey. Or maybe you're a nurse that is thinking about becoming a nurse educator. We're excited about you being here as well. All right, so now we want to take a look at some of the content that we're going to build on from this introduction. So first and foremost, we talked about the hallmarks of excellence in our previous snapshot, and we want to align it with different elements that are part of the model. These components feed directly and align directly with our nurse educator competencies. So the one most aligned with the conversation we're having today, there's about 3 that align, is the diverse, well-equipped faculty. We want to demonstrate our commitment to valuing the nurse educator or the nursing education experience for our students. We want to also look at the literature and know exactly what it says about evidence-based practices. And we want to commit to being a change agent, right? If there needs to be changes to our curriculum, if we need faculty development experiences that are more aligned with the work that we are doing, then we want to reach out to our leadership team and advocate for getting whatever support, whatever resources we need to do a really good job. One example would be attending conferences where we are not only in a great community that is talking about and having really common and familiar conversations with each other about how are you aligning the essentials, or how are you moving forward with competency-based education? What tools are you using to make sure that your outcomes, your program outcomes, are aligned with the actual learning objectives in your courses? So first focus we want to have is looking at how we respond. So we know nursing is constantly changing, right? That's exactly what Billings and Halstead talks about on page 3, that last paragraph. It says the future of nursing care delivery will be changing to a community-based, consumer-driven system. This is causing a shift in the emphasis from acute care to primary care. Now, what do we know about this edition of Billings and Halstead? Well, it was published in 2020, right? That's why there's a 7th edition. But this is what we already know as we've looked at the alignment between content in the 6th edition and 7th edition. We know that it's still the same, some of the same statements, right? Because we know that nursing changes happen inevitably. Our question here really is, how ready are we for those changes? How are we responding to the changes in nursing? And what is it that we still have an opportunity to improve in? All right, so this specific article really talks about AI. We know that's a hot topic, right? Looking at AI and how do we adjust our content in our nursing program to ensure that we are equipping, not overwhelming, but equipping students with the information that they need about artificial intelligence and using advanced technology? Well, let me summarize a little bit about some key elements that this article talks about. First, it says that we have to focus on how AI is changing nursing practice. We have to realize the potential, I highlight that word potential, to shape our future as a profession, making sure that we are equipping our nursing students, our future nurses, future nurse leaders, educators, with the education and training regarding AI, tackling relevant ethical considerations and challenges, and really embracing and increasing our knowledge about AI-enabled robotics and telehealth solutions. Because this is what we know, technology, advanced technology is not going away. Our ability to be successful in the faculty role starts with mastering, yes, our ability to deliver content in our classroom in a way that allows learning to happen. I'm going to say that one more time. It starts with this foundational elements. No coincidence that we started in chapter 1. There's no coincidence that competency 1 is all about how do we make sure we're a really good teacher. That's our foundation. And closely aligned with that step is making sure that we have the expertise that we need to engage and ultimately integrate the technological advances that are needed to be taught in our nursing program. So this is a closely aligned step as we think about the skills we must master. Number 1 is being a very effective teacher to promote learning. Second of all is being able to integrate advanced technological concepts and strategies in our classroom that allow the student to not be distracted with technology. How many of us have had a loved one in an acute care facility, in a primary care facility? How many of us have been patients, right? Oftentimes, technology can become a distraction. So what tools can we give our students to decrease that likelihood of this happening? And then faculty shortages. How are we adapting to those faculty shortages? Do we have other support resources in place? Do we have a partnership with a vendor such as ATI or a textbook vendor that can really bring in these evidence-based strategies with support, right? With a representative that can help us navigate, implementing, and integrating all of these wonderful advances that their specific product has to offer. And then adapting to addressing and ultimately embracing interprofessional collaboration. We have to figure out how to work smarter together and not harder, especially if we are within a school of health sciences. Are we bringing in PT, OT into, and speech language pathology is another one, into our sim lab, into our skills lab to really promote that IPC that we know is critical when we think about the care delivery process. And then fostering evidence-based pedagogy. These are just some of the clips of conferences and presentations that we've been a part of. This is how we engage as an educator in sitting in the seat. The great thing about teaching is that we learn twice. The second great part about teaching is that we get to learn from others because we embrace the skills that are associated and the knowledge that is translated when we engage in pedagogy. So attending those conferences, advocating for yourself to identify what funds are available. And then, of course, diverse learners. We know that there are all different types of learners in our classroom, and we have to think about not only the diversity as far as race or ethnicity, but also the different learning styles. So our ability to really embrace the diversity of our learners starts with us being knowledgeable about the different teaching strategies that we integrate and how it aligns with learning theory. All right, so that's for a future snapshot. All right, so our thought-provoking question, the answer is A. If you chose A, give yourselves a round of applause. Rapid advancements in technology. And let's talk about why. All right, so first of all, when we talk about technology, we know that requires us to be competent, like we talked about earlier. Second of all, you want to think about what is included under that educational framework. So that includes artificial intelligence, virtual simulation, and LMSs. We know all of these various AI advanced technology tools are revolutionizing how we as faculty deliver and assess education. Although evidence-based teaching and faculty shortages do affect the learning experience, they absolutely affect nursing education, and they are critical to explore. But it's technology that is going to have, and currently is having, the most profound potential to truly redefine our faculty role. Okay, so that's the rationale for why A is the best option and B and C are not. Okay, and if you have questions, remember that we're happy to be here to answer any questions that you want to send us via email. Time is our most valuable asset. All right, so you're probably noticing a theme that we've talked about this topic now a couple of times, and this is because one of the number one reasons, or I should say the top reason, that many nurse educators put off the C&E, and this is what we hear all the time, is lack of time, right? And there's only 24 hours in a day, and how can I fit this all in? Well, that is what we can help you with. We can help you figure that out. Reach out to us, info@drsellarseducate.com, or you can go to our website and you can see all the resources that are available. And for our next snapshot, we already have our thought-provoking question that we want to share. So how can nursing faculty best prepare for the integration of IPE in our teaching practices? All right, so think about that one. Until next time, we have enjoyed having you here. Go ahead and put in comments one takeaway that you are going to integrate into your teaching practices as a result of us discussing some of the steps that you have to take in order to feel like you're mastering your role as a nurse educator. The old days of us sitting and talking at our students have changed. We're now in a discussion, an active discussion to promote active learning in our classrooms. This is the best strategy that we can use to help ensure that our students are actually engaged in the learning process. Advanced technologies are here to stay. We have to embrace them. So very closely alongside to our ability to be a really good educator, to facilitate that knowledge, is going to be our ability to really integrate advanced technologies in a way that decreases overwhelm and increases competency with our student. Reach out if you have questions, info@drsellarseducate.com, and we look forward to seeing you in our next snapshot.